Let's talk more about COVID. As more variants spread across the county with different infectious rates, it may get confusing on what it means for you, whether you're vaccinated or not. So joining us now to explain all of it is Dr. Karen Call. She's chair of the pathology department at North Shore Health System. Doctor, thank you so much for joining us.
Thank you for having me on tonight.
The first thing is, what is a variant? And I mean, you say COVID-19, but everyone gets a different variant?
Well, we're seeing a growing number of variants as we've been hearing in recent months in this country and around the world, and this was not unexpected. This is what viruses do. And it boils down to understanding the sequence of the virus, the DNA or RNA sequence. It's very much like getting an ancestry test, or if you've sent DNA from your dog out to find out what breed they might be. The more closely aligned DNA sequences are between organisms or creatures, the more identical they are. And this was used early on to identify that COVID was in fact a coronavirus, and then to try and identify what type of coronavirus. And what we're seeing now is that as the virus is evolving, every time it replicates its DNA, it acquires a few changes. This is allowing it to develop into different forms or variants of the virus, and we're understanding that they behave a little differently. So that's what we're seeing playing out right now across the country.
So everything is a coronavirus. We were talking about COVID-19. So
yeah.
Is Delta like 20, or where are we now?
So no, we have actually many more variants than that, some of which are not clinically relevant. I'd say in the United States right now we have 4 major types that we're following closely, and many more that we don't hear very much about. You may recall early on that they had names like B.112, and that was kind of a scientific way of naming these. It was quite confusing. So now we are using the Greek alphabet to name these.
Because of the
Alpha
confusion.
was the one that came from Great Britain and was a bit more severe. And Delta is of great concern right now because it spreads so easily across the country.
Was there an alpha? Was there a beta? I mean, it just went from alpha to delta?
No, there's alpha, beta, gamma, and all the way on down the letters of the Greek alphabet. And again, some are less frequent, so we don't hear so much about them in the news. Some don't seem to have any clinical relevance. And again, they aren't making the news, but there's virtually almost all the Greek letters now with respect to what these variants
are. So Lambda is one that people have been talking about lately, too.
Yes, indeed. Indeed.
So these are the more severe? Is that why it's being talked about more? And are the vaccines able to take care of all these variants?
Well, I think that's an excellent question. And they may not all cause more severe disease, but they may be in the news, as you just heard about with Delta, because it is spreading so wildly. These variants, these sequence changes, give a selective advantage to the virus of some sort, be it in terms of the disease they cause or how quickly they spread. And the concerns we have to do with when these changes occur. Can we still detect them with our diagnostic tests? And yes, that has been the case all along these last year and a half. But we're also concerned about whether monoclonal antibodies that might be used as treatment are as effective against one strain or another. And then we have concerns about the vaccine as well. There's been some studies that show that Delta is not as well covered by the vaccines we've been getting. And so that's something we obviously have to pay attention to.
So to wrap it all up, no longer COVID-19, we should call it the coronavirus and start identifying the variants with the Greek alphabet, right?
Well, we should still call it COVID-19, but within that branch of the COVID family tree, we're seeing all of these variants.
Okay, all right.
And they're all just a little bit different.
Dr. Karen Call, thank you so much. Be safe, be well.
Thank you.